Welcome back, deep divers. Today we're going deep into abdominal trauma.
Oh, yeah, this will be good.
We've got a chapter from a paramedic textbook
Okay.
and a couple of real-life case studies
Hmm.
to really see how these injuries are managed out in the field, when every second counts.
Right.
You'll learn how something that seems like a minor injury can actually have huge consequences,
Yeah,
and how paramedics use vital signs to figure out what's really going on inside, even when the injury isn't obvious.
exactly. It's a tricky area, abdominal trauma. The abdomen's vulnerable, even though it's protecting all those vital organs.
So let's start there. What makes the abdomen so vulnerable? I mean, yeah, it holds most of our vital organs, but is there something more to it?
It's more than just the number of organs in there. Think of it as a really packed space, not a lot of room to spare. So even a small impact can cause a cascade of problems. Organs can get bruised, torn, or even ruptured, and that leads to internal bleeding, which, as you can imagine, isn't always obvious right away.
So it's like a hidden enemy, unlike, say, a broken bone where you can, see the damage.
Yeah, exactly. And that's what makes it so challenging for paramedics. They can't just rely on what they see on the outside. They have to be like detectives,
hmm
looking for subtle clues that could mean there's a serious internal injury.
Now, the textbook uses the term hypovolemia. Sounds serious. What does that mean exactly?
It is serious. Hypovolemia just means a decrease in blood volume. It's essentially uh, losing blood, often internally. Imagine losing a liter of blood. It's a lot, and your body reacts in all sorts of ways you might not expect.
So even if someone seems okay after an abdominal injury, paramedics are trained to look for those early signs of shock, the things we might not notice.
Exactly. One of the first things they'll see is a rapid pulse. Your heart's working harder to pump the remaining blood around. You might also see cool, clammy skin as your body tries to conserve heat. And then, if the blood loss keeps going, mental state can change, confusion, disorientation.
So even if we're not paramedics, knowing these signs could be the difference between thinking, oh, it's just a little bump, and realizing, hey, this could be serious.
Yeah,
Yeah.
absolutely. Recognizing those signs could be crucial in an emergency, like knowing that even what seems like a minor fall could be a much bigger deal for a kid. Knowing when to get help for yourself or for someone else could literally save a life.
Right. Okay, let's get into the first case study. This one takes us to Harbor Grace, Newfoundland. Picture this. It's 2:15 in the morning, and there's a young man lying by the curb holding his stomach. He's been attacked, stabbed while trying to protect his wallet.
Classic penetrating abdominal injury. And the details here really show how important those subtle clues are, like we were just talking about.
Right, so there's a cut on his lower left abdomen, his shirt soaked in blood, and he's conscious, but his pulse is racing. That's
Huh.
a shock sign, right? But here's the thing. His blood pressure is normal.
That's what throws people off. You'd think with blood loss, pressure would drop. But especially early on, the body compensates by constricting blood vessels, speeding up the heart rate. It's like the body's trying to buy time, keep blood flowing to the important stuff.
So the normal blood pressure is a bit of a trick. It doesn't mean everything's fine.
Nope, it's a temporary fix. If the bleeding isn't stopped, that pressure's going to drop and things get a lot worse. That's why paramedics are trained to look deeper, see the whole picture.
So what happens next? What do they do for him?
The case study talks about oxygen, dressing the wound, careful positioning to minimize further injury. All pretty standard stuff, but the reasoning behind it is key.
So it's not just about stopping the bleeding, getting him to a hospital. There's more to it.
You got to understand what's happening inside the body. The oxygen helps his tissues get what they need, even with the blood loss. The dressing isn't just about the bleeding, it's also about preventing infection, which, with abdominal trauma, can be deadly.
And the positioning, why is that so important?
It minimizes movement, less chance of more internal bleeding. Think about it. Every time he moves, those injured organs are getting jostled around, maybe making things worse. And there's another risk mentioned in the case: evisceration.
Evisceration. Wow. Okay. That sounds intense.
Yeah, it means the internal organs are pushing out through the wound. It's rare, thankfully, but it's a serious complication. Needs surgery right away.
Okay, so we've got our stabbing case. High stakes, definitely, and a lot to learn about how the body responds to trauma. Those subtle clues paramedics are trained to spot, but let's switch gears now and look at something completely different. This time, we've got a 6-year-old boy, Henry, out riding his bike, takes a spill, lands right on the handlebars.
Oof, that's gotta hurt. And yeah, that kind of direct blow to the abdomen, that's always worrisome, especially with a kid.
And here's the thing. Unlike our first case, there's no blood, no open wound, just a little guy complaining of a tummy ache. Easy to brush off, right?
Not so fast. External injuries, they can be scary looking, but they don't always tell the whole story. Remember, we're talking about a packed space full of vital organs. And with Henry, no obvious trauma, it makes it even trickier to figure out what's going on.
So what were the paramedics looking for? What were the warning signs, so to speak?
Well, Henry's symptoms were subtle, but they were definitely cause for concern. He had abdominal pain, and it was getting worse. His abdomen was distended, meaning swollen, and it felt firm to the touch. And when they gently pressed on his belly, it hurt.
Pain on palpation, as they say. What does that actually tell us? I mean, any bruise hurts when you press on it, right?
Sure, but in this case, pain on palpation, it suggests that there's inflammation or even injury to the organs inside. Think of it like this: pressing on a sore muscle versus pressing on a broken bone. Different kind of pain, right? Tells you something different is happening.
So even though we can't see an injury, these signs are telling the paramedics that something could be seriously wrong inside.
Exactly. And this is where knowing the differences between kids and adults is so important. The textbook really hammers this point home.
What do you mean by pediatric differences? Do children experience abdominal injuries differently than adults?
In a lot of ways, yes. Children's organs, they're bigger proportionally, and they're closer together. So more likely to be injured by blunt force. Imagine trying to fit the same number of puzzle pieces into a smaller box. Less room for error,
Yeah.
right? And their abdominal muscles, they're not as developed, so less protection.
So a fall that might just bruise an adult could actually cause some serious internal damage in a child.
Exactly. And kids, they can't always explain their pain as well as adults. So paramedics have to be even more careful in their assessments, relying on those subtle clues to guide their decisions.
It sounds like a real challenge, like solving a puzzle with some pieces missing.
That's a great way to put it. Now, in Henry's case, his abdomen wasn't just distended, it was also firm. And that's a big deal because it suggests internal bleeding.
So even though we can't see blood, the paramedics are using these clues, like the firmness of the abdomen, to try and figure out what's happening inside.
Exactly. And that's why it's so important for paramedics to really understand anatomy and physiology, the mechanisms of injury. They need to be able to connect the dots, even when those dots are, well, subtle and hidden.
Okay, so we've seen two very different cases of abdominal trauma. A stabbing with a clear external injury and a bike accident with no visible wounds at all. What's the connection here? What's the takeaway? It seems like early recognition is key in both cases, wouldn't you say?
Oh, absolutely. Stabbing, handlebar injury, doesn't matter.
Yeah.
Recognizing the possibility of internal bleeding, acting fast, that's what makes the difference in abdominal trauma.
Because the sooner they can do something, the better the outcome.
Exactly.
Right.
Untreated abdominal trauma. That can lead to all sorts of long-term problems: organ damage, infection, even death.
Right, so this is serious stuff. It's not just about patching someone up and sending them home. These are potentially life-saving interventions.
You got it. And, we've been focusing on paramedics, but these lessons apply to everyone. Knowing the signs of abdominal trauma that can help you make better decisions in an emergency, even if it's just knowing when to call for help.
That's a good point. Even without medical training, we can still make a difference. Now, there was something in the textbook that really caught my eye. It said that kids are more prone to splenic injuries than adults. The spleen, that organ tucked up under the ribs, apparently it's pretty vulnerable, especially in kids. Any idea why that is? What makes their spleens so susceptible?
That's a great question. It's what we always say here on the Deep Dive: stay curious. The textbook gives us the basics, but it doesn't always tell us why. And that's where the real learning happens.
So you're throwing down a challenge for our listeners. I like it.
Exactly. Think about what we learned about kids' anatomy. Their organs are bigger, proportionally closer together, and those abdominal muscles, not as strong, not as much protection. Do those things play a role in the spleen's vulnerability? It's a fascinating question. I bet our listeners have some great ideas.
Maybe we'll even bring it up in a future deep dive. Share some of those listener theories. Who knows? But for now, I think we've given everyone a solid understanding of abdominal trauma. They've got the knowledge, they're asking the right questions, and they're ready for whatever comes their way, whether it's a medical emergency or just a better understanding of how their bodies work.
Couldn't have said it better myself. That's what the Deep Dive is all about. taking complex information, breaking it down, making it fun and engaging, giving our listeners knowledge they can use in their lives.
And this is just the beginning. We've got tons of exciting deep dives planned. We'll be exploring everything from the human brain to the latest in space exploration.
So stay curious, keep exploring, and join us next time as we take on another fascinating topic.
Until then, happy diving, everyone.